There's some questions that they've asked us on the internet, and one of them has been, how do you avoid hiatal hernia? Well, it's kind of funny. It's not that hard to avoid it. It's because you're born with it. Congenitally, there's a weakness at the site where the esophagus enters into the stomach, and so therefore you can't prevent this. This is something that you were born with. Can we apply or can we do surgery on a person who's had abdominal mesh? And the answer is yes and no. So how do we do that? We would first have to put a small little camera in to make sure that there was no adhesions. As long as there was no extensive adhesions and there was no possible injury to the bowel that could occur, we will be able to do the surgery laparoscopically. However, if there is extensive adhesions and we feel that it's not safe, we won't do the surgery. Can we do crunches after hiatal hernia repair? And the answer is yes. I probably would want to wait at least 6 to 8 weeks so that the fixation and all the suturing is steady, and then we would slowly implement crunches and abdominal exercises so that you can get your abdominals back to where they were before. Another question is, can we have hiatal hernia and weight loss surgery at the same time? And the answer is yes. So what happens is sometimes we might incidentally find that you may have a hiatal hernia, and what we would do is we would fix the hernia and then we would proceed either with the gastric bypass or a gastric sleeve. But yes, the question is that it doesn't prevent us from you having the surgery. Another question is, can you have gallbladder surgery and weight loss surgery at the same time? The answer is yes. However, some people don't like to do that at the same time, or the doctors don't want to do both surgeries at once, but it has been done in the past, and but it is not a restriction that you have one surgery or the other. They can be done simultaneously if you like. Well, another question that's come up to us is, how do you avoid gallbladder surgery? So there really isn't a way or an indicator to say, oh, you're going to have your complications or have your gallbladder taken out. It's mostly genetics and also diets and also weight loss. So there's a combination of things that will make you more inclined to have gallbladder surgery. However, there is no pure answer that I know of what will make you a worse candidate or a better candidate for having gallbladder surgery versus not having gallbladder surgery. Why would a patient need to have gallbladder surgery? So sometimes, due to your predisposition or genetics, you will form gallstones, and also having high cholesterol also makes you prone to having gallstones. And once those gallstones are there, they can irritate or cause inflammation at the gallbladder. Number two, you can have a cystic duct obstruction, which means that the bile is being blocked by a gallstone. Or thirdly, you can have a stone in the common bile duct, which affects the whole entire biliary tree. So there are specific tests that we like to do to make sure, but those would be some of the indications that you would need to have gallbladder surgery, because otherwise you will not get any better. Another question I received is, will you be healed if you have gallbladder surgery? And is it a cure-all? Yes, if you don't have gallbladder surgery, you will not get better. You will have to have gallbladder surgery, or called laparoscopic cholecystectomy, to remove the gallbladder. It is almost 90% or chance that you will feel a lot better and those pains in the right upper quadrant will go away. However, there are some predisposition of you forming gallstones, and one is, unfortunately, it's weight loss. So if you do have weight loss surgery, there are some medications that can prevent you from forming stones, which is Actigol, and those are medicines that we would like to implement. However, it's not 100%, but there are options to prevent you from having gallstone formation after weight loss surgery. So many people have asked us what a gastric balloon is. So a gastric balloon is implemented endoscopically, or you can now swallow the balloon, and either can be filled with gas or silicone, and it's placed in the stomach. And what it does is it occupies and makes you feel full all the time. However, the only downside of having a gastric balloon is that the maximum amount of time that a balloon can last inside your stomach or stay there is only 6 to 9 months. So it kind of defeats the purpose, because once you take that balloon out, you start gaining weight back. How many times should I see, or should I see a dietitian? I think it's a great idea to see a dietitian before and after your procedure, because that he or she will help you keep your calorie count intact. We would like to see them at least 6 to 8 weeks after the surgery, and then as you start getting and reaching your goals, you can see them less and less. And what I mean by that is because by the time you lose more weight and you learn how to eat, you become less reliant on your nutritionist or dietitian. What are the requirements for weight loss surgery? So number one, if you have a body mass index, which is calculated from your height and weight, greater than 40 or equal to 40, you automatically qualify. If you meet the standards of the body mass index of 35, you will need two comorbidities for the insurances, like hypertension, diabetes, possibly sleep apnea. The last is, now they're opening up another frontier or possibility, meaning that if you have a minimum of 30 BMI, you will also be a candidate for weight loss surgery, and that would be the minimum for the whole United States right now.